Welcome Anatomy 41 students. This is workshop 5, the cardiac cycle. So by the end of this activity, students should be able to define the terms that describe the physiology of the heart and also explain the overall steps of the cardiac cycle. As we're working through this workshop, if you want to pause the video at any time to fill out any questions, you're free to do so. You'll also complete a live portion to your workshops where you'll log into Zoom and have some sort of live activity or question and answer period with an instructor as well. So let's take a look at an oscilloscope versus an ECG. An oscilloscope detects the amplitude of an electrical signal using only one cell. So if we look at this detection, they've placed a lead inside and outside of an axon to detect the electrical signal of depolarization of one cell, and that electrical signal can be seen right here on the oscilloscope screen. This relates to an ECG with patients getting hooked up to an ECG machine reader. Different leads would be placed throughout the body, usually near the umbilical region, the ankles, and the wrists. And this detects electrical changes from the heart from the skin, and many cells are involved in an ECG reading. From an ECG reading, you get out a reading of several PQRST complex graphs. In each section of the ECG, this stands for one heartbeat or one beat in the cardiac cycle. The cardiac cycle are all of the events that happen within a single heartbeat, and that includes the electrical changes of the heart, which is shown by an ECG. It includes all the physiological changes of the heart, which chambers are contracting and ejecting blood, and the ventricles, which pump blood out. But the ECG just measures the electrical changes of the heart. The P wave itself would measure depolarization of the atria, which will happen right before atrial contraction. So an electrical signal gets passed from the SA node to the AV node right before the atria contract. The QRS complex stands for ventricular depolarization, which means the depolarization of the ventricles when an electrical signal gets passed through them right before ventricular contraction. And then the T wave stands for ventricular relaxation, ventricular repolarization, when everything in the ventricles would go back to normal. So in ECG reading, you'll get several of these PQRST complexes in a row. And if anything is abnormal within the electrical signaling of the heart, if someone's having a heart attack, the ST segment would be elevated or higher. If someone is going through ventricular fibrillation, you would just see these kind of scraggly lines all in a row. So the PQRST kind of ECG machine is a great way to measure someone's electrical activity of the heart and then be able to diagnose problems from that. So phase 1 of the cardiac cycle involves atrial contraction. So this will involve when your AV valves are open and increasing volume from the atria to the ventricles. So the atria will contract in phase 1 and blood will be actively pushed from the atria to the ventricles. And if you remember, the atria are the superior chambers of the heart and the ventricles are the inferior chambers of the heart. One side of the heart is in blue, showing where deoxygenated blood is, and the left side of the heart is in red, showing the oxygenated blood. So this is phase 1, atrial contraction. The ventricles volume is increasing, which then in turn is increasing pressure in the ventricles. This is important to increase pressure in the ventricles so that during ventricular contraction, the increase in pressure can slam shut your AV valves. Your AV valves are your atrioventricular valves located between atria and ventricles. The right AV valve is called your tricuspid valve, and your left AV valve is called the bicuspid or mitral valve. When these AV valves slam shut, that's what the doctor listens for when he listens to your heart in the stethoscope. He's making sure these valves slam shut all the way so that no blood is going back with the way it came from. This also increase in pressure causes your semilunar valves to open, and the semilunar valves are these guys. They're located right before the great vessels exiting the heart. So your pulmonary semilunar valve is located right in front of the pulmonary trunk from your right ventricle, and your aortic semilunar valve is located right in front of the aorta in your left ventricle. So blood will actively be pushed from the ventricles to the vessels. Then phase 3 involves ventricular relaxation. So after the blood has been actively ejected from both ventricles, the pressure again decreases because you don't have as much blood volume. So this decrease in pressure will slam your semilunar valve shut, and that's the second heart sound that the doctor is listening for in the stethoscope. Blood will flow passively again from the atria to the ventricles as the ventricles fill up with blood. So this is ventricular relaxation. So this is a great cardiac cycle animation that we'll watch together here. And I'll just do a quick new screen share and we will watch it right now.
The heart is a pump which must circulate blood through two different but interconnected vascular systems. The smaller of these systems is the pulmonary system. Blood returning from the upper part of the body is delivered to the right atrium of the heart by the superior vena cava, one of the body's two largest veins, while blood returning from the lower part of the body is delivered to the right atrium by the other major vein, the inferior vena cava. Contraction of the right atrium in each cardiac cycle forces blood into the right ventricle. This is followed by contraction of the right ventricle, which pumps blood into the pulmonary artery, sending it on through the blood vessels of the lungs. As the right ventricle contracts and pressure within the right ventricle rises, the tricuspid valve situated at the opening between the right atrium and right ventricle shuts, preventing any backflow. The pressure generated by contraction of the right ventricle soon opens the pulmonary valve and blood enters the circulation of the lungs. After passing through the circulation of the lungs, the blood, having been recharged with oxygen and having rid itself of carbon dioxide, is returned through the pulmonary veins to the left atrium. The left atrium, too, contracts, forwarding blood into the left ventricle in order to fill it before it contracts. As the powerful left ventricle contracts, the mitral valve shuts, preventing backflow into the left atrium. The aortic valve opens and blood is forced into the aorta, which distributes it to the rest of the body apart from the lungs. As the contraction comes to an end and pressure in the aorta falls, the aortic valve snaps shut to prevent backflow into the left ventricle.
All right, so we'll stop this. We'll go back to the PowerPoint. So that's a great kind of summary of the cardiac cycle animation. Now, if you want to pause the video and try to draw an ECG tracing of a normal patient, and then we'll come back together and I'll show you what that will look like. Okay, so an ECG of a normal patient, I kind of described it already when we were talking about the ECG hookup. But this is what an ECG of a normal patient would look like. So you have a normal P wave, which again stands for atrial depolarization right before atrial contraction. The QRS complex stands for ventricular depolarization right before the ventricles contract. And then the T wave would be the ventricular repolarization or relaxation. So again, this is signifying one cardiac cycle or one heartbeat. Just showing the electrical signals that's going on. But again, during this ECG, the electrical signaling, those three phases that we just talked about would be covered when the atria contract and the ventricles contract and the ventricles relax again. So this is an ECG of a normal patient. Again, each heartbeat would have one of these sections over and over again as the ECG machine continues to read and monitor the patient's heart. Things, again, that would be abnormal would be if the ST segment was raised, if what we call the PR interval, the distance from this P wave to this R peak would be extended, could also signify some sort of blockage in the AV node, or the QRS complex could be inverted, or you could have ventricular fibrillation where everything is kind of scraggly. So in general, the ECG is a great tool that the medical community uses to monitor electrical activity of the heart. And that is the end for this workshop video. Hopefully we'll see some of you guys in the live Zoom environment. Take care.